Dr. K. Reddy from LBR Dental and Implant Center. Have been placing implants since last 15 years and I've done more than 25,000 implants. So we do both basal as well as the conventional dental implants. But for international patients, we generally prefer conventional implants. You must be wondering, conventional implants, we cannot do immediate loading. Immediate loading in the means where we fix the teeth on implants in less than 7 days. But here what I do is I do a CPBCCI protocol. We use a crystal polished implants and engage them bicortically. So we engage the deep basal bone. Instead of the regular cancellous bone, we engage the deep basal bone and fix teeth in 7 days. So since we do this immediate loading on dental implants, a lot of patients from different countries, especially from Australia, US, Canada, UK and some Middle East countries, a lot of patients come to the LBR Dental and Implant Center. So today we have with us Mr. Richards, who have come from Tennessee, USA. So he had some issues, so he wanted to get them corrected, and he came here for a full mouth rehabilitation. We give only zirconia teeth on a titanium frame. So here I would also like to mention many patients do travel to India for zirconia teeth, but many are not getting them on a titanium frame. So it is very important to note that the zirconia teeth should be on a titanium frame and they should be screw retained teeth. So here we have Richards with us. We'll ask him how his experience was. Yeah, hi Richards, hello. Thank you for choosing LBR Dental and Implant Center, and you have traveled all the way from Tennessee to Hyderabad.
Yes.
I know it is about 20 plus hours journey, and maybe you have to fly 2 days. So do you think is it really worth coming to Hyderabad?
Oh yeah, it was very worth.
Okay, so would like to explain how was the process here? And a lot of patients are worried about the anesthesia and the pain which endured. So how it all went through? Can you share your experience?
Hey, well, first I really liked how everyone explained everything to me. Got me easy. I was relaxed, and then surgery went really well. I mean, I was getting numbed up really well. And I still felt a little pain, but I mean, that's worth it. I mean, after surgery, I didn't really have any pain. And the next day...
You didn't have any pain, right?
No.
Okay.
I had pressure. There's difference, like pain, but this is like pressure.
Okay.
And I did feel pressure, like bone pressure, but nothing that ibuprofen. I mean, I took one ibuprofen and it worked most of the day, so it wasn't anything bad. I mean, as far as pain goes, that's not a reason not to come here. I don't know any other reason. I mean,
and many say like in US the treatment cost is very, very high, and here how do you find the cost when compared to US?
a tenth of the price. I mean,
tenth of the price?
I would say this would cost over $130,000 in America.
Okay.
And this costed me a little over $10,000.
Okay.
So I mean, that's worth it.
And for your information's sake, we have used the same implants which are being used in US. We have used the Norris Medical Systems, which is even being practiced by many doctors in US. Mm-hmm. And we have given you solid zirconia teeth on a titanium frame, which is screwed onto the multi-unit abutments on implants. So here we have done all upper all on 6, and lower we have done all on 6, and upper on the left side there was a soft bone here. So the regular small implants were not suitable. So I had opted for a zygomatic implant, which is little longer implant. But still we could finish this entire procedure. We could finish it in less than 7 days. So he had come here for about 12 days so that we can do some post-operative checkups. And so we have placed the long zygomatic implant under local anesthesia. So did you feel any pain while I'm doing?
No.
Not really? Okay.
No.
Okay.
No pain on the top. What got me was I felt a little more pressure maybe on the bottom.
Okay.
But I mean, you're getting your teeth pulled.
Yeah. No pain, no gain. No pain,
right,
no gain.
Right. I mean, the pain.
Yeah. But it was bearable, right?
Yeah. It was very bearable. Knowing what I know now, I would still have the surgery.
Okay.
I would definitely come here.
Okay.
I wouldn't go anywhere else.
Okay.
I read all your credentials, I researched you, and you're the very best.
And many say, are scared to travel all the way from US, Canada to India, saying, the journey is too long, and can we really trust those surgeons, so what do you say to them, like, who are really scared that,
Yeah, well, I mean, the airplane is going to be long. I mean, it's not bad. It's, you get something to sleep. But as far as the doctor, give me an American doctor that has anywhere close to your, certificates, knowledge. There's not any. I mean, you're the very best of everyone that I've researched, by far, not even close. You're an amazing, implantologist.
Yeah, you can show your teeth there. So here, for your sake, like we have not done any bone grafts, we have not done any sinus lifts. In fact, for any patients, even though even if you do not have any bone, people who are absolutely have no bone at all, still the bone grafts are not required, the sinus lifts are required. We just have to do the sinus bypass, and sometimes we do bone grafting, but the patient's own bone, so that is called as autografts. So we relocate one part of the bone to the other part where we really require. That is only when we require it. So we call it as autografts. Otherwise, in general, we don't use any artificial bone grafts, and sinus lifts is absolutely not required at all. So we place the implants, we remove whatever the teeth you have, we'll place the implants and fix teeth in 7 to 8 days. So, but another 4 days is required for post-operative checkups, and then you can enjoy this Hyderabad culture, tourism, so even he's going on, tomorrow for Hyderabad sightseeing, so I'm sending my assistant along with him, so that he can enjoy Hyderabad culture, and he can see some places which he really wanted to see when he come here for Hyderabad. Okay. So anything more you would like to tell viewers?
This is almost seemed like a vacation instead. I mean, everyone here is very nice.
Okay.
Nobody's rude. I mean, no complaints at all.
Okay.
Yeah.
Thank you so much, sir. Thank you coming all the way from Tennessee to Hyderabad.
Yeah.
I know we have changed your smile and life altogether.
Yeah.
And in fact, we went for a lunch today also. Like we went for a function where we had lunch together, and he could eat normally. Like there were no restrictions. I didn't tell him not to eat any particular food. I told him whatever he wants to have, let him have. So he has been enjoying his meal since last 2-3 days. So we asked him to eat whatever he wants from the day of fixation. There is absolutely no restrictions at all. So I'm really happy, very, very happy about changing people's lives. And thank you so much, sir, for giving me also the opportunity, to help you.
Yeah.
Okay. Thank you.
Well, thank you for changing my life. I mean,
thank you so much.
I hadn't had a smile like this in over 20 years.
Okay. Thank you so much.
Thank you.
And if you find this video informative, and in case if any of your friends or family members are suffering with lack of teeth, and if they are unable to chew properly, and if they're having problems with the dentures, so do share this video with them, and tell them that so and so person has traveled all the way from Tennessee to Hyderabad. It's like we call it as a dental tourism or dental vacations. So don't be absolutely scared. We are very friendly, we are very highly skillful, and we do all type of advanced surgery, so there is no need to worry at all. And having said all these things, as Mr. Richard said, we only charged him 1/10 of what is being charged in US. So kindly do share this video with your fellow citizens, and if you have any questions or any apprehensions, please do message me. So I would be really happy to answer them. Thank you so much.